House Democrats want a robust public option. Now Senate Democrats are considering an optional one. Either way, the so-called public option is front and center in the healthcare debate. Kenneth Thorpe is chairman of the Department of Health and Policy Management at Emory University in Atlanta, and he has helped Democrats work on healthcare legislation, and he joins us from Washington. Kenneth, good to see you again.
Great to be back. Thanks.
A couple of things I want to get to you on here. We paid really close attention, as you know, to the health care debate in the bill coming out of the Senate Finance Committee. And up until, say, Monday, it really looked like the template for the final Senate bill. And now, got to tell you, as you know, that bill does not include a public option. We are seeing this dramatic comeback of the public option. Why do you think that is?
Well, I think what's happened is that people are finding that the cost of their health insurance in the private sector is high and rising. I think there's tremendous concern out there among the public about how much health care is going to cost. And the one thing that we know about the public option, the robust one, based on Medicare payment rates, is that those premiums would be about 10% less on average than what you would pay for a private health insurance plan. So what's cost?
So explain this to us. We'll put up the polling on this as I ask you this next question, because the public option is gaining in support here, even since August when well, you remember August as well as I do. So explain this public option. Is it Medicare expanded?
Well, it would pay based on Medicare payment rates, which are about 30% less than what private health plans pay hospitals, for example. The benefit package would be a little bit different, but it would look like Medicare. But I think it's important to make sure that people understand it's only available for people buying coverage through the insurance exchanges.
Okay, so this is this idea of Medicare plus 5 that we're hearing these days?
That's correct. So the plans would pay in the House version at the Medicare payment rates plus an additional 5%. So still substantially below what the private sector pays, a little bit more beneficial to providers than what the Medicare program pays.
And what do you think of the opt-out feature that's being discussed now that may be available in some legislation for states?
Well, I think that as you started, the art of politics here is compromise.
Yes.
And my sense is that we'll end up, if anything, to have a public option where it is optional, meaning that the states could either decide to include it in their exchanges or not. There could be a trigger that says that unless we get costs growing at a slower rate, only at that point would the public option come into play. So right now there's a lot of variations on this theme being discussed in both the Senate and House.
Okay, great. A lot of variations being discussed. You're in the room right now with Reid and Pelosi, and what are you saying to them as someone who is grappling with these issues every day? What are you saying to them about the way forward, what they should be considering when it comes to the public option?
Well, I think we need to make sure is that we get the bill passed. And if we can get a public option in there that can attract 60 votes in the Senate, some version of it, that is terrific. But I think what's important is to make sure that we don't lose sight of the bigger issue here, too, which is getting more Americans covered, moving to universal coverage, and also targeting some of the other issues driving health care spending, which is rising rates of chronic disease and an explosion of chronic illnesses like diabetes and high blood pressure. We need to come back and figure out more effective preventive ways to address those issues as well.
So you would be happy with, if you don't get everything, you would be happy with something that passes, even if it's an incremental first step?
I think it's important to put a stake in the sand here to make sure we're going in the right direction towards universal coverage and putting into place mechanisms that are going to get health care costs under control. I think what we're seeing here in this discussion is that nobody's going to get their first choice. The real challenge here in crafting this legislation is to make sure that everybody's second choice is not the status quo. That's probably the worst option. So we're going to have to craft a compromise position here where we can really make substantial movement on expanded coverage and controlling the growth in health care costs.
Kenneth Thorpe, it's great to see you as always. Thanks for your time.
No, thanks.